Hi, all. I'm thrilled for us to today have Dr. Martha Eddy, who's going to be discussing bone health, getting stronger, and staying taller from Move for Life. Please join us, this description, on bone health for a lecture on bone health with Dr. Martha Eddy, designer of Moving for Life for cancer recovery. Having strong bones plays an important role in reducing the chances of injuries, along with being able to stay active with varied daily tasks and recreational activities. We'll be discussing what proper bone health is and how to do our best in keeping our bodies strong through exercise, posture, body awareness. Dr. Eddy will provide tips about DEXA scans, osteopenia, osteoporosis, and ways to get stronger, a key to longevity with a high quality of life. References will be made to eating the proper nutrients. However, the focus will be on role of movement and strengthening exercises and having healthy bones. So, Dr. Eddy, the floor is yours. Thank you.
Thank you, everyone. It's great to be here. And I really do want to emphasize that my doctorate is in movement science. So I'm very skilled in physiology and how our body works when things are going well. And then I've spent the last 30 years designing exercise and dance programs for when things are not going so well. And just to say right away that Moving for Life is 25 years old. We're celebrating that at this time. And it was originally designed for women with breast cancer, but instantly became used and applied to women with gynecological types of cancers as well, because we were working with Share Cancer Support, which works with reproductive health. And then we were also at Gilda's Club. So then we found out men with breast cancer and men with other kinds of cancers also enjoyed our movement classes. And what's special about them is that they are aerobic, which is another component in a different lecture about how important it is to get aerobic activity to help your cells heal. Because as you may all well know, um, a lot of cells can be hurt by either chemo or radiation. And so today we're going to focus on bone cells and the different layers of bone tissue and how exercise can help us stay strong with some reference to nutrition, but knowing that I'm not a nutritionist, so I won't answer any detailed questions there. But I've been around this work for a long time, and I'm a woman over 60 who also, exercises and has wanted to learn as much as possible myself. So I'm sharing that knowledge. So I'm going to share screen and have a little bit of a PowerPoint slideshow. I think everybody has this capacity. If I'm ever demonstrating a movement, feel free to slide your screen so I'm bigger and the slides are smaller. There's a little white line on Zoom that allows you to make me bigger if you'd like. So I'm a movement analyst. That's what this is about. And that means that I'm trained to observe human movement. I can look at both the postural movement efficiencies as well as kind of where we are in terms of learning about coordination and how coordinated we are, as well as the quality of movement. Is there a lot of tension in the movement, or is it really kind of floppy? Um, and how that relates to our early childhood too. You may have heard of low tone and high tone babies. Well, we all were babies once, so we were one of those or something in the middle. And so there's a lot of knowledge behind looking at our community and giving individualized tailor responses. So all of our teachers are trained to do that. They're trained to answer questions or come back to the larger body of knowledge. We have a wonderful advisory council of oncologists, surgeons, and lay practitioners who are cancer survivors. And so when we have a question, we try to get you the answer. So today I'll do my best, but know that we'll also research. I'm also a master somatic movement therapist. So soma means the living body. And movement therapy is basically a very holistic approach to understanding your own movement. Is your walk causing you back pain? Is how you sit or stand affecting your organs or your back or, your body image? And so we work with all of these different connections, privately, one-on-one, but also as teachers. And so this is embedded even in Moving for Life. And then, as I mentioned before, I have my doctorate in movement science. Right now, I'm an honorary professor at Columbia University's Teachers College in the Biobehavioral Sciences Department, where I graduated from. So I'm honored to be available to them as a resource, as well as to continue to do collaborations with some of the faculty there and students. And then, as mentioned, I'm the founding director and now the research director for Moving for Life. So we have various research studies, one that we did with New York University, others we've done with Columbia University and NIH. And hopefully there will be more again. So going to the next slide, what are the issues going on with our bones? Well, the bones are important for protection, right? They protect our internal organs. They're also kind of our structure. So you'll see that at the bottom, our structural support. And so it becomes very important to be aware that our bones not only are giving us our shape and our form, but they also are protecting some of the many parts of our bodies, including our brain, our heart, and our lungs. The bones have different layers of tissue. The marrow is the deepest layer, and it is really important for producing blood cells. And so that's not just the red blood, but the white blood. And you may know that synonyms for the word, other words for the white blood cells is lymph. It is the immune system. So the lymphatic system carries the white blood cells, and the white blood cells are out eating up viruses, taking care of different problems, basically working to strengthen our bodies so that we're available to protect ourselves, not just with the bones protecting our organs, but literally protecting against bacteria and viruses and toxins. And so post-cancer treatment, there might even be some different kinds of drug toxicity that needs to be expunged, that needs to be gotten rid of. So working with exercise again, and that flushing that happens with sweating and doing aerobic activity is very important. But then with Moving for Life, I've also added in a lot of squeezing. And if you just want to do a little squeezing right now to help lymphedema, to move the white blood cells, and then also then straightening the elbows and even swiping the skin can help move the lymphatics system, which we call lymphatic drainage. And so our bones need to be strong to be able to protect us, and they need to be vital and healthy in order to keep creating white blood cells as well as red blood cells, which are the ones that are oxygenated and that carry oxygen into our cells, other cells, so that they can heal and grow and have activity. So the other thing that bones do is that between the bones are our joints, and that's where movement happens. So if it weren't for our bones having so many different joints, we wouldn't have the ability to paint, type, cook, wash dishes, dance, move, push things, lift things, and all the things that we do. It's our muscles that pull the bones. And as it turns out, it is the pulling on the bones that actually reminds the bones that they need to heal and grow every day throughout our entire life. However, bones also have a lot of mineral in them. They're a place of storage of minerals, and especially calcium and phosphorus. And I think you all might know that calcium is really important in muscle contraction. And so if you're over contracted, in other words, you get a muscle spasm or an ache or a cramp, that's something about the balance of magnesium with calcium and phosphorus. So minerals are what get depleted when we have osteopenia and osteoporosis. We start to lose our density because some of that mineral storage and mineral makeup of the long bones starts to get eaten away at. It's needed. The minerals are needed for other parts of our bodies. So I'm taking a breath, just letting that settle. Our bones are so important for protection, for developing blood cells, for storing and releasing different kinds of substrates that we need for energy production, for movement, and also for our posture. They're our framework. So again, protecting organs, but also the muscles are attached to bones and they make up our body shape. So supporting our bodies and facilitating movement. So again, we're going to spend some time with posture today. We're going to spend some time with pulling and pushing that help to get the bones to continue to stay dense, to stay strong, to stay thick. All right. So the bone, again, has different layers. And the periosteum is the skin. Peri means around. Osteo is bone. So periosteum means around the bone. It wraps the bone. So it's a layer. Then we have the compact bone. That's the hard bone that we think of. But don't think of a skeleton like you might see at Halloween. You want to think about a very blood-rich, alive, growing set of bones through our bodies, over 200 different bones. So, and then inside this spongy bone, our soft tissue is where those cells are being produced. So we have the bone marrow deep, deep, deep inside the spongy areas, or inside the hard bone, just kind of alive and full of blood as well. As you can see, there are nerves going to the bone, so we can have bone pain. And there are also blood vessels, veins, and arteries. So arteries are what bring the red blood. And then you may have heard of blue blood. Blue blood is the returning blood to the heart that has not enough, the oxygen is left. It's mostly carbon dioxide. It's what we're going to breathe out. So again, breath is very important, even to our bones, and certainly to all the tissues of our bodies. Again, we talked about minerals. One of the most important is calcium. It's a crucial mineral for bone health. It provides the hardness and strength that our bones need in order to take the weight of our head, 40 pounds, over our chests, over our lower backs, over the pelvis, over our legs. So we need to have strong legs, we need to have a strong spine, and actually we need strong arms. When we have a bone density scan, a DEXA scan, those are the three places that are often checked for, usually just on one side because most of us are fairly symmetrical. I think they sometimes check the non-dominant side, knowing that your dominant side is a little stronger, meaning the side you use more. But sometimes we pull more with the non-dominant side. So there's a kind of estimation that's going on. It's in terms of just representing our bone health with a DEXA scan. If there are real problems, I'm sure that one could ask for more thorough investigation of every bone in the body, or at least both sides of the body. So again, the arms, the legs, usually the thigh bone, which is called the femur, So we have an iliofemoral joint. That is our hip joint. And the femur is the thigh bone coming into the pelvis. So the weight coming through the pelvis goes into the femur. And it's one of the biggest bones in the body. It is the biggest bone in the body. So it needs to be strong for walking, even for taking weight and sitting. Like right now, as you sit, if you're sitting, if you want to stand, that's always great. You want to put a little pressure into your feet. You want to rock pelvis a little bit. You want to activate your body so that with that, you can stimulate bone growth. Okay, so movement and pressure is so important. So rather than sitting back and just dumping your weight, it's kind of resting into the back of your spine, the more you can line up your whole spine, and I'll show you more about this later, ear above shoulder, above hip, then more of the weight is going through the dense, big vertebra of the spine, which is the third place that's tested by the DEXA scan. So the arms, the legs, specifically this forearm, which is two bones, then the big thigh bone, the femur, and then the spinal column, the vertebral column, usually in the chest and lower back region. So calcium is vital for other things, as I mentioned before, muscle contraction. And I will keep kind of repeating myself because I find it's very important to have as much information as possible, but it's hard to remember everything. So in general, we try to have everybody do as much as they can to hear something and then hear it again in a different context. So that's a big part of what I am trying to do as a teacher.
Martha, can I interrupt you for 1 second? I
Yes,
received
please.
a message from someone asking, is the things that you're discussing today, can it be applied to someone in a wheelchair?
Absolutely. So when I've been talking right now, I've been talking about sitting and rocking in the chair. Now, if you can't get your feet on the ground, that makes it a little harder, but you can use the pedals as a kind of place to push against. So both of those are quite possible.
And she said, she just wrote more, exercise specifically for sitting in wheelchair.
Exactly. So sitting, so what I was just describing about sitting, if you're in a wheelchair or in a chair or on a stool, all apply. Can you just tell me if you still see this share screen?
Yes.
Okay, I'm going to turn that off for a second and just spotlight so that you can see me. So I'm going to demonstrate a little bit more about being in the chair. And I'm giving you a side view and then I'll turn forward. So basically what we're looking for is to get our feet on the ground. So I've got my shoes on today. This obviously can be also barefoot. You want to have your full foot on the ground whenever you can when you're sitting. If you're back here, you might think that that's helping you build bone because there's some pressure in your back, but really the part of the spine you want to grow in are the bodies of the vertebra, which are really deep to the middle of the body. So as I mentioned before, and I'll come closer to show you this alignment, we want to line up our ears with our shoulders, with our hips. And we don't want to be back of our legs. We want to have our weight going into our legs. So I can kind of push. So for me and other people that are able to stand up, you can just kind of make that weight shift from the sit bones to your feet and then come up and stand tall. If you haven't that capacity, just pushing into your feet to the extent that your legs allow and to the extent that there's no pain. Everything I'm suggesting is monitored by you somatically. You are listening to your living body, your soma. And when you listen to your pain levels, your comfort levels, you can know whether or not you can come up a little bit, bend a lot, bend just a little, keep your legs more out here. You decide what's best for your ankles, your knees, your hips, and also your feet themselves. Another exercise you can do in a chair, if you have enough stability from the pedals or the floor, is a kind of rocking. And this is good for the lymph. It gets the lymph flowing. So if there's edema and swelling, it also moves the interstitial or intercellular fluid that causes swelling. So just rocking is good, but it's also putting pressure into the bones. And that is what causes bones to grow, to keep our density really strong. So we need to know about our bodies and find out if our calcium levels have depleted, and they do deplete a lot with menopause. So if there's been an early menopause because of treatment, then with medications, there can be an early menopause, then we need to start all of this earlier. If you have a later menopause, it's really important to think about, am I getting the calcium I need in my food? What supplements are recommended for me by my medical team or my health team, my nutritionist? I often will move one leg in front of the other and sometimes use my arms a little bit to come up. This is a little exercise for strengthening the arms. If your chair is firm enough and strong enough, you can just bend and straighten the elbows and activate the wrists and forearms. You can hold your weight up a little bit, stretch out your pelvis. And I'll show all of this again a little closer to you. But I wanted you to see the feet are on the floor. There's a rocking potential through the hip joint into the pelvic bone, into the spine. It goes all the way up to my head. I learned this from my teacher, who was a physical therapist at New York University and helped a lot of people through the polio epidemic get back to walking. She was considered miraculous. Other people, other physical therapists were not having her success rates, but it was because she had trained in movement analysis in Germany. And she is the person who taught me how to observe human movement very subtly. And that is what we teach our teachers in Moving for Life. So showing you again from here, demonstrating once again. Notice head as much as possible, back and up, long neck, natural curve. We have something called primary curve that are based on having been in utero, curled up as embryos and fetuses. And then we develop secondary curves in our neck and our lower back. So our body is designed to have a curve of the back of the head, a little curve, not too much of a hunch, but a little curve right in here. In the thoracic vertebra, that is the chest. So the thorax is the chest, and it's where the ribs attach to make the rib cage. So we have a round here, and round here, and then more convex, an arch here and an arch in the neck. So we're looking for this nice curve here and here, but we don't want it to be too much, because then our weight is not going through the middle of the vertebra. We really want the bodies of the vertebra to receive the weight of our heads. So when you put your head forward, that's 40 pounds, and it gets even heavier as you go forward because gravity is pulling on it. That's what makes it 40 pounds, that extra pull from gravity. So finding what we call an anti-gravity feeling, like your head is floating upward, is an image. You can imagine your head is a balloon, as long as it doesn't make you dizzy, and that it's just floating up and that your spine is a string, and that there's a little bit of energy right here in your center. So again, ear over shoulder over hip, weight into your legs, a little bit more sense of your pubic bone as an arch that is supporting you in sitting. And then a readiness to rock. And if you need to curve, sometimes fine. One of the main reasons I have this pillow here is also if I do want to sit back, I want to have, most chairs are too far back. So if I put it here, it's keeping my little lumbar curve and it's giving me something to push against in a gentle or relax into in a gentle way from my heart level at the bra strap. So just right in there, I can rest back and then I can look up as a nice stretch. I can look down, I can turn and just again check in. At this moment, I'm a little back, but that's okay for sometimes. And then more upright would be here, and more forward would be here. And then this is slumping. I'm good at it too, working at the computer, feeling like I gotta look. So one of the things I do for my spinal posture and health is actually an eye relaxation class where we palm. You might want to do that with me. I'm going to come forward again. And this is another place where a pillow can come in handy. You can put your hands on a pillow and rest, or you can put a pillow on a table in front of you and rest. And just cover your eyes for a moment. We have so much screen time. We have so much looking at the phone, looking at a computer, and it's very helpful to take some time to just breathe and rest our eyes, because our eyes, first of all, sit inside a socket that is made up of multiple bones. Our forehead bone, our cheekbone, our nasal bone, our lateral bone, which is called the temporal bone, almost part of the jaw bone. And so all of those come together to make the eye socket. So this is helping those bones just breathe and relax, but also giving your retina, the visual screen full of blood in the back of your eyes, darkness. And it needs darkness. And sometimes, especially those of us living in urban areas, don't get full darkness. So again, a big breath in through your nose, down through your diaphragm, into your pelvis. I've had a cold. You can hear I'm stuffed up. And then slowly out the nose if you can, or through your teeth, you can make a little hiss to slow down the exhale. The longer your exhale, the more relaxed you'll be. So again, I'm going to go ahead and use this as an exercise now. I have my eyes still closed, my eyelids down, my hands covering my eyes, but I'm sitting up tall and I'm letting myself hold my arms for a minute, which is a nice isometric exercise to strengthen the arms. For just one more deep breath. And then either hissing or slowly out your nose. Now, keeping the eyelids down, go ahead and remove your hands from your eyelids, your eye area, if you have had them covered, and just notice how much light comes in through your closed eyelids, and turn your head right and left. Depending on what time of the day it is for you, you might have natural light in the room, or you might have your own lights on, and you can just use this as a chance to bathe your retina by turning your head right and left with light. And then relax and flutter your eyelids open. Okay. So I'd love, even though it's screen time, if you feel like writing something in the chat about how that felt, We're going to go back into our lecture and learn more about the bones and how density is developed and how movement helps. But I'm just curious what it's like to just take that time for yourself to be relaxed. And certainly if there's a question, we can do that. I'll go back to the share screen.
There's a question in the chat, and
Okay.
someone asked, what is the best way to read in bed or on a lounge at the pool? Which I
Ah,
Ellen.
such a great question. Um, we are inclining this way. So again, if you have some kind of pillow that allows your arms to kind of rest under them, that can be great because you want to keep that line. You want to just, doing this with the head is really not great for the neck and really not great for getting the density that we need through the chest area. However, if you're resting and this is your recuperation, like the rest of the day, you keep your posture very strong. And, sometimes you just want to slump a little bit. That's part of life. It's okay to have different postures. That's what we want. It's movement. But when you stay in one position for more than 10 or 15 minutes, if you can line up your joints so there is what we call equal joint space, equal pressure in all parts of the joint, not more on one side than the other, that's going to keep the discs healthy, the ligaments healthy, and your arms strong. So you might want to just do that for a few minutes and then put your arms down. Some people have the luxury at home of getting a special table that has a book on it that can incline. So it will be at different angles so that you can look up at what you're reading. Or if you're looking at television, or if you hook up your book to a big screen, you can read on a big screen that's more off into the distance, which is also great for your eyes. I don't know how many of you know what 2020 means when we talk about 2020 vision, but it means that when we're relaxed, our eyes are designed to see 20 feet away with clarity. And as soon as we're coming into any space that's less than 20 feet, we're working, we're using extra muscles, we're flattening the lens or bulging it in different ways for different distances. So when we use the lens in an active way at near vision, that's actually not relaxed, it's work. So it's important to look out 20 feet. Even if you're lounging outside, it's a perfect place to read for a while and then look out into the distance and rest our arms and then come back to it. That's in an ideal world. So again, you just have to play and just know that change is important. Once you get really cozy in one position and stay there for more than 20 minutes and don't switch to the other side, you're getting ready to start to have some muscle tightness on one side, or even the organ might feel a little squished. So you want to breathe into your organs and let those bones have the protective function, but not the compressional function on the organs. You want them to make space and be a container for your organs. Hope that was helpful.
There's a couple of questions in the chat. Do you want to answer them now, or how do you want to do
Yeah,
it?
let's take a couple more. And if they make more sense later, I'll just say I'll answer it later.
Sure. So someone continued the question about how about lumbar in bed reading?
So meaning what should the position of the lumbar spine be when we're
Yeah.
in bed?
Uh-huh.
Yeah. So if you can sit up on your sit bones and get pillows behind you in bed, that's better. If you're down low and it's just your head forward, that's kind of the worst. So if you can at least curl deliberately or lean forward more from the hip joint, that's the best. The joint that's best designed for forward movement, especially if there's weight, is your hip joint. It's fine to lean forward on your hip joint and look at something, but it's when we start curving the spine and over curving the lumbar spine that, first of all, if you already have osteopenia or osteoporosis, osteopenia is the beginning of osteoporosis. Osteoporosis is already a kind of level of calcium depletion that means you're at risk for bone fracture, bone breaking, then pressing down on it with a curved spine that happens while reading in bed can be not great. You want to be more lined up again so that the bodies of the vertebra are getting the weight directly versus scrunching in the front. And that also can cause bulging of discs and herniations or ruptured discs, other kinds of problems, especially if we're standing up or carrying weights. And some people have jobs that really require lifting. So we need to lift through the arms, feeling the back muscles and the abdominal muscles supporting us whenever we lift. We might come back to that a little later.
Another comment was um, loved eye exercises, breathing through teeth. Never had anyone explain it like that.
Thank you. Yeah, for me, it's very important because it is often our head coming forward that changes our whole spinal posture. And again, this is one of the best weights that you could, I mean, I'm going to show lifting weights a little bit, but and using what we use in Moving for Life is whatever you have in your living room, or if you're in one of our live classes at either the hospitals or the community centers or libraries, then we sometimes loan these out for people to use or encourage people to buy their own, especially for, cleanliness reasons. So the TheraBand is called a resistance band, a Dynaband. So having some resistance is really important. And again, our head going back is one of the best types of downward pressure that gives something for our vertebra to stay strong and be resistant to. If our head is forward, it's really just coming down through here and jamming in the back of our neck. And actually, that also can affect our vision. If we're very, what's the word, tight, if these muscles are cramped and closed at the suboccipital level, this is the occiput, the bottom of the skull, then that affects our eye movement and our eyes taking in information. So great that you enjoyed the eye exercise.
And then one last question. Someone said, "Do you have?" Oh, um, I have to prepare for my double mastectomy and reconstruction later this month. Can you help me with exercises to do before and after, and some lymphatic massages? Do you have pillows that you'd recommend for neck, back, and ear issues? Okay, that's same person, but another question.
Yeah,
Um,
yeah, those
so
are
I guess,
great.
yeah.
I mean, I think I'll actually start with the pillows because I already addressed that a little bit. So this is a good thickness for lower back. You can just use a towel. I'm someone who uses scarves a lot, especially in the winter, but even in the summer, like a shawl. And I will just fold it up if I'm in the theater and put it behind my lumbar spine. Just a half an inch is all you need. I mean, I'm noticing what I have access to. And even if I have to wad up something like this, it's all I've got, it here. And then I just put it right down. And this chair's not perfect because there's a big hole there, but I can put it right there. And that helps me keep my lumbar spine, my lower back, in its convex curve versus the ribs are going to be more this way. Then we have this curve and then the head. So we want to have not too, you can actually saying a lot of things at once. So I'll try to say them a few times for you. You can actually be forward with your head, but it's making the curve straight. To be a curve, it needs to come back. It goes forward and then back again. So that is the weight that needs to come down into the midline of the throat region, like right behind the soft tissue, the tubes, your esophagus and trachea, your windpipe. So, and then down into the ribs, the chest where the ribs attach. So other pillows could be a little pillow here for the neck when you're sleeping. When you're side sleeping, I've kind of trained myself to fold my pillow while I'm sleeping. So if my pillow is thicker, I can just have this distance filled out, this 4 or 5 inches thickness of the pillow. But if it's this thin pillow, I kind of fold it and then it's more thick. So you want that distance covered. If you're here all night, it would be a bit of a stretch, which if you need, it might feel good. I'm a little tight here today because of some position I slept in. So just having a pillow sometimes right in the crook of the neck and then another pillow taking the weight of the head can feel good. So again, I'm looking to not be flexed for too long, or if I am flexed, meaning side bending, I need to have a little something supporting me, and it's pretty cozy. It feels good. So that's the neck, that's the lower back, the side, and on your back. If you have a really thick pillow, then it's going to jut your head forward again. So training yourself to take the pillow away when you're on your back is another one. And it's amazing what you can do in your sleep. I actually am tracking my sleep quite a lot. I've always gotten 7 or 8 hours of sleep, but I do a lot of traveling, so I'm jet lagged. And so I'm curious what the quality of my sleep is. And this registers how much movement is happening. And it's totally fine to move for 5 to 10% of your sleeping at night. But if you're moving a lot more than that and not getting back to sleep, then that can be a problem. So great questions, because when we're sleeping, gravity is also massaging us, and it's gravity that may give us a little more density as well. So like I said, posturally, just lining up, that is helpful. But it's the anti-gravity, the push or the pull of our muscles working that are really working our bones. And we need, as we get older, to actually do more with our muscles, with extra weights. These are ankle wraps, or you could probably use them on the wrist. So you wrap them around and they just give you extra weight. But I sometimes just carry them. And then I can do, for instance, wrist exercises. That's where I'm most vulnerable. So I'm working to work the wrist from different angles, thumb up, back of the hand up, turning over and side or coming this way, and then behind me, different kinds of angles of working and repeating, or circling is one of the best exercises because then you're using everything. And then if it's feeling very easy after doing 10 or 20 of these kind of things, you want more weight. And if it's hurting just to do even 4 or 5 or 6, then you definitely need to take it away. So you're looking to do about 8 reps comfortably. That's the weight you want to use, 8 repetitions. If you can do 8, then build your way up to 20, then you're ready for more weight. This is just standard understanding of what you might do with machines or with what we call free weights. Hope that was everything. If I missed something, let me know. Okay, I saw one more. Yes, we spend a lot of time sleeping, and there are people that will, occupational therapists, and Sounder Sleep System is one that is based in the Feldenkrais method, which is a somatic method. And I believe they would come to one's home, getting the lymph nodes moving. Also, that was the other question. We do a whole lecture on lymphatic drainage. So hopefully that's something that Woman to Woman might bring back another time. But for sure, just really working with moving just at the level of the skin and helping drain the lymph is very important. I do have a few more slides that I would love to go to.
Perfect. And I just want to be mindful that we have only 10 minutes left.
Exactly.
So I
That's
want to
what
make
I
sure you
was
get that.
noticing too. So I'm going to speed through them a little bit. And here we go. I'm pretty sure. So we were talking about calcium. And the key thing is that if there's not enough calcium coming in through the diet, our body starts to take that calcium out of the bones. And that's what leads to low bone density, weakened bones. And that's when we're more at risk for bone breaks. So phosphorus is also important, and it works with the calcium and helps make them more, again, density I like more than rigidity, because they're actually alive with cellular tissue, but often the other word will be rigidity. And magnesium helps us absorb our calcium, and zinc and copper are needed. So just good to know that trace minerals like manganese, also very important for the ligaments, help in bone density and development as well. And so now we're looking at strength training. We've talked about most of this. So bone density is the amount of minerals per unit inside your bone tissue. Higher bone density means stronger bones. And during childhood and adolescence, it increases, and then it peaks out in the late 20s, even before menopause. But then during menopause, it really shoots downward. So an adequate intake of calcium, phosphorus, and other minerals is really important for bone density. So I think I've made that point. And people over 50 generally have lower bone density. And then the risk of hip fracture is really quite strong. So again, osteoporosis and osteopenia is reduced bone mass, but it's not as severe. And then osteoporosis means we've really dropped. And you can see that it goes down, down, down as we get older. So having some extra calcium is so important. And it can cause mostly fragile bones, which lead to some kind of fracture. We've talked about the spine, the hips, and the wrists as the places of testing, because those are the places where most breaks happen. And it's not good to fall, because things will actually slow down in other parts of our life where we need to be more active. So you can screen. We've talked about that. You can talk about medicines. You can look at how they interact with anything related to cancer. And you can take a blood test to check your vitamin D levels, because D levels are very important for overall health. And then eating a good diet and staying physically active is really important. So this is one study that's looking at physical function and osteopenia, but I'm going to move along and talk about our recommendations. So what we do for food, physical activity, and weight management can really help. So muscles weigh more than fat, and muscles also pull bones. I've said that many times. So the more you can change your density of your muscle to fat ratio, which is referred to as body mass index, the better. Now, there are various questions about the quality of how doctors or medical settings, or even lay people measure their body mass index. One of the things we want to do is really feel the tone in our body. That's a more somatic way. Am I strong? Do I feel flabby? And really keep our muscles as toned as possible, because that's what's going to be pulling on our bones as well. So we want to do weight-bearing exercise strengthening at least 2 to 3 days a week. Again, good posture and alignment are important. Back muscle strengthening, safe lifting and moving with holding an object, and also keeping the hip as the hinge for bending are really the most important activities. And our muscle strengthening can also help our balance, especially if we're noticing equal use of each leg, the nice alignment of our spine, the ability to lean over the hip joint. So we have a chart that we can look at called think of the strong, steady, and straight. Strong. We want to be strong. We want to be steady. That's balance. And we want to be straight. That's our posture. So here's strong, steady, and straight. I can send these two charts to you, so they're available as kind of visual aids with the video. I think this is too detailed to go into now, so we'll share that with you. And then just so you know, bones are constantly growing and it's called remodeling. Old bone tissue is reabsorbed. So this is the good story. And as it's resorbed, the osteoblasts in class are very active. And with that, there's repair at the micro level. So when you have the right amount of nutrition and rest, I'm going to say as well, and pressure, meaning resistance, work through the muscles into the bone and with gravity, you can help remodel your bones. And the consequences of that is that cancer cells release a hormone that can speed up the release of calcium. So it's even more important to make sure you have high levels of calcium. Hypercalcemia in the blood is not great. We want to have that calcium back in our bones. So we need to speed that up by having more absorbable calcium in our diets. And then vitamin D, we want to watch out for again. Okay. So I think I'm going to end with that. We know that it's important with different types of cancers to really pay attention. And the jaw area is another area that you want to work. And we want to make sure that we're using different weight bearing exercises, meaning your body is getting weight, like your spine down to your sit bones or through your legs by standing, but also using different kinds of resistance training. I'm going to show you some weights, and maintaining good posture and working on your balance are really important. Now, aerobic activity where you're walking, like walking, possibly jogging if all of your joints are okay and you've got the energy, yoga and dancing, standing or seated, whichever you can do, are really important. So at Moving for Life, we welcome people to come to class with a chair, or stand and use the chair for support, for helping to get better balance by using one leg at a time with your hand nearby, ready to support you, or to sit on the chair if a joint starts to hurt. If you know you have a leg problem, if you're just fatigued and you want to sit down, it's better to keep moving and get the arms and the spine moving and get the hip joint getting that pressure of weight shifts, even in the wheelchair or chair. And if you happen to have a walker, you can use that as well. So we've already talked about this. Bone grows and remodels in response to forces placed on it. And this happens to be called Wolff's Law. After an injury to bone, placing specific stress in specific directions can also help. So a physical therapist will understand that. Here is our plumb line, and here are the ways we don't want to sit. So hopefully you'll remember that. So this is where we put the little pillow here. You might want, if you're inclining backwards, like on a lounge chair at the poolside, then you might want a little pillow in your neck. These are putting pressure in the wrong places, okay? So good old-fashioned posture makes a difference. Standing or sitting, helping the spine, and focusing on getting some weight through the spine, through your legs, and then taking breaks and just, you might do that now, picking up your arms and just circling them 20 times in one direction. Or if you can only do 10, that's fine. Building up to 20. And then even some people can do 100 in a direction, or they just think more about the whole song that they're listening to. So that's a great exercise as well.
Martha, I want to thank you so much. I do reckon
Yeah.
it's 12:59, so I want to be mindful. One question that a couple people have messaged me about is, do you have any recommendations of someone to teach about better sleep positions? Like, do you have any recommendation or a website that they can review
Yeah,
individually?
I mean, that's what I was just saying, that the Sounder sleep system is the only one I'm familiar with
The
that focuses.
Sounder Sleep System, it's called.
Yeah, that's what I had mentioned before, but also um, any somatic movement therapist. So if I'll put it in the chat, is meta.org is where somatic movement therapists have a page. I have a page there. And so most somatic movement therapists will do home visits, not all of them, but they'll do Zoom home visits too
Uh-huh.
and help people talk through the setup in their house. Or some occupational therapists and physical therapists will do that. There are also some physical therapists that specialize in osteopenia and osteoporosis. And so you can ask about that as well.
Thank you so much. I think this was great. I think that based upon the amount of questions that we've had, this is definitely something that our community wants to learn more about and return to. So don't be surprised if I email you asking to return. This was wonderful. So thank you so, so much. And I hope everyone has a great rest of the day.
And I'd love to make an announcement that's specific to this coming week, starting on the 13th. Movingforlife.org is having not just our usual aerobic dance class, which has the strengthening component built into it, but we're also having a move-a-thon, which means that there are a lot of classes that are free, but we're asking for donations if you can. But the main point is that a lot of the teachers are teaching other classes that they love to teach. So there might be one that's about lying down, and that's a great place to ask questions of the teacher, because most of our Moving for Life teachers are also either movement therapists or Pilates instructors or have a master's degree in dance education. So they're very highly skilled. Okay. Thank you.
You mentioned sending us the chart. You gonna send us the chart?
Well, I'll send it to Jillian and then because I have to extract it from the PowerPoint and then
Okay.
she can put it with the recording. Okay.
Perfect. Thank you.
You're welcome. Thank you for being here. Thank you for your questions. And I hope you do visit Moving for Life. I hope you know those classes are free and online. And then we do have some live ones if you happen to be in the New York area or Cincinnati or LA, East Bay of California or some of our other locations around the world. So
Well,
thank
you
you
so
again.
much again, and everyone have a great rest of the day.
Thank you, Jillian.
Bye,
Bye.
everybody. Thank you.
Bye. Thank you. Bye.
Bye.